I think that looks good. We can get started. My name is Anna Cash. I'm the Training and Technical Assistance Specialist with NCAL. So I'll be helping you all out today with this webinar. If you need anything tech related, I am your person. So we're going to keep moving through the slides. All right, just a short disclaimer. This project was awarded from the Office of Victims of Crime, and the opinions, findings, conclusions, and recommendations expressed in these materials are those of the contributors and not necessarily representative of the official position or policies of the United States DOJ. And a couple of housekeeping items before we get in to the content. You all are experts at this, but we always want to stay muted unless we're speaking to limit the amount of feedback that we're getting from other people's Zooms. And you all know how to use the chat feature, but feel free. I know that Madeline put in where they're coming from. So if you want to kind of join in that, we can share out our names. Also remember, if your screen is not, or your Zoom box is not showing the name you would like to be referred to as, please change that. I think everyone's looking good. To answer Madeline's questions, we will have the slides. I'll email you all the slides afterwards if you would like them before or as we're moving along. Just drop your email and I can send that over to you as well. This is a relatively small group, so if you do have any questions, feel free to raise your hand and unmute, and Betsy will take some questions. There's also spots during the presentation where we'll have some Q&A time, and of course, the chat's open throughout the whole time. So if you do have anything immediate or just want to comment on something, you can use the chat function. We won't have breakout rooms today, so no need to worry about that. And again, if you have any tech issues, please shoot me an email or a private message and I can help you out today. All right, so our presenter, you know quite well, Betsy is joining us today. She's the Training Assistance Advisor for the National Elder Abuse MDT Training and Technical Assistance Center and works at Lifespan of Greater Rochester. So her role is comprised of providing technical assistance and trainings on topics related to abuse in later life, such as this, as well as the development and enhancement of multidisciplinary teams. She's also a helpline specialist for the Upstate New York Elder Abuse Helpline for Concerned Persons, which provides support and resources for individuals concerned about the safety and well-being of older adults throughout Upstate New York. She's also worked at Vera House in Syracuse, New York, and was the E-MDT coordinator for Central New York E-MDT Hub. She started and facilitated 7 teams in the Central New York region, so she's an expert, and was also a project coordinator for the OBW Abuse in Later Life Grant, providing training for law enforcement and victim services and service providers throughout New York State. She provides trauma-informed services, including support groups, crisis intervention, and support to individuals 50 years and older who were victims of domestic and sexual violence, elder abuse, and exploitation. She lives in Syracuse, New York, with her husband and adult daughter with Down syndrome. And while it's not snowing, you can find Betsy and her family cycling and walking on the Erie Canal. So big welcome to Betsy. And I'm going to turn it over to her to start our presentation.
Thank you, Anna. Yes, it is not snowing. I think if you can see it on my computer, it's 57 degrees, which is considered like a heat wave in Central New York, especially in early April. This is awesome. So these are our learning objectives for today. I'm not going to read through them because I'm going to actually talk a little bit more about them in a minute. But I love this image because today I want to talk to you a little bit about some of the tougher parts about being an E-MDT coordinator. And I love that she's got like, 6 hands and all the different things, because that is the life that we lead as coordinators. We kind of do it all. And as I was thinking about putting together this presentation, I was realizing there was so much, and there were so many questions that used to run through my head, like, I don't have a case for next week. What am I going to do? Or I cannot get that law enforcement person or whoever to call me back. And these are all the very standard, very normal things that E-MDT coordinators go through. And hopefully we'll have some strategies, some ideas for you to use as you start moving forward with your teams and developing and working on this really incredible project. So today I want to talk about case finding. We'll talk a little bit about case finding, structure and presentation, as well as tracking and documentation. And while pretty much every one of these topics could be its own 1-hour webinar or longer, I think we're just going to kind of briefly touch on each of them, but there's going to be a lot more opportunity for you all to get more information on these issues through PLGs, through trainings, like we've got our coordinator training coming up, and one-on-one TA. I think that that's a really great opportunity for you to meet one-on-one with either myself, Lisa, Bonita, or Vicky. Kylan also does, she's our lead TA, so she'd also be able to provide some assistance, and a former coordinator to really get more team specific for you in dealing with these issues, because each team really is unique. And it has its own kind of life, and you might need a little bit more focus on that. So these are all opportunities for you to get that assistance. And I will also be sending out a package, or actually Anna will be sending out a package that has samples that I'm referencing. It'll have other resources that are going to be available to you for these issues. And it'll be a nice little package for you to work through and help you kind of get started or enhance if you're already a team that's been on its way. So let's jump in. And before we do that, I'm going to take a sip of water because I can feel my throat getting scratchy. Thank you. So the keys to case finding. Case finding is really a product of all of these little or large issues of community awareness, case review criteria, case review process, and team membership. Each piece kind of interconnects and making a way for our teams to get the cases to the table to really do the work that we are called to do as E-MDTs and as E-MDT coordinators. The first one is going to be community awareness that I'll talk about. And this is just so important. You can't have an E-MDT and not have the community know about it. I mean, you've got to get out there into the community, do the trainings, do the outreach, and really let the community know that this E-MDT exists and that it's a tremendous resource for the community and for older adults that in particular are being abused, but just in general. I mean, I think that this is a really solid approach to preventing elder abuse. And we're going to talk more about those different things as we go forward. But if you can get out and really reach some of the more diverse communities in your area so that they know that this is a resource, and really, if you can stress the benefit of this collaboration, it benefits the service provider and the person that you might be doing the outreach to. But ultimately, and why we really do this work, is that it benefits the older adult or the victim in this case. And our purpose is to get the best possible outcome for that victim of abuse. So community awareness is a really, really integral part in this process. We also want to take a really good look at the case review criteria. And I'm going to actually work backwards in this slide. You want to make sure that your criteria is understandable. And it needs to be understandable from the point of view of the team. So your team members need to know about it, but the community needs to be aware and understand what the criteria is. You don't want it to be too narrow or too broad. And I kind of learned my lesson on that one when I first started doing outreach. I would talk about our E-MDT is here to take some of the more complex cases of financial exploitation. And I didn't realize that I was really shutting out a lot of folks who had issues and had cases that they wanted to bring to the team, but thought, oh, well, mine isn't complex enough. Or I don't know, there might be some financial exploitation, but there's probably a little bit more of other stuff going on that I'm not sure about. So again, keeping it, having some parameters important, but not too broad. It's kind of like, it's an evolution, I think is the best way to look at it. You're going to start developing your case criteria and you want it to really fit the team. So you want to look at the strengths and limitations. You want to look at what cases you're going to take. Is it going to be the financial exploitation, the elder, or the physical abuse? And you really want to tailor it to what your team is and the strengths of that team. So again, we'll talk more as we get into this discussion today, but the team will evolve and it's going to change, and being aware of that is going to be important, and keeping an open mind to your criteria. We also want to look at our case review process. There is nothing worse than going to a meeting and spending an hour or an hour and a half and walking out, or clicking out in our situation, and feeling like you just didn't accomplish anything. You didn't go anywhere. Or you feel like it's actually worse than when you walked in the door. So being sure that you've got a really nice, streamlined case review process, that the team members have been a part of that process and developing what is the important information you need to have, how is it going to be presented. You really want to make sure you're using the expertise at the table. So if you've got a forensic accountant and a geriatric psychiatrist, you want to make sure that they are having opportunities to have input and insight on these cases. So you really want to include them in that. I think probably one of the most important pieces is having a really strong intervention plan or recommendations that come from that meeting. It's our job as the coordinator to kind of pull that out sometimes. Sometimes it doesn't sound like you're getting anywhere, but as the coordinator, we need to be listening for what those recommendations are, and then summarizing at the end so that everybody knows what's the plan, what are the steps that need to be taken, and really important, assign those follow-ups so that people know what their job is, what their task is, whether it be over the course of a month. Maybe you need to set some dates that you're going to do some follow-up. And another important piece when it comes to assigning the follow-ups, you want to consider spreading out the work so that it's not all going back on the caseworker. I know a lot of the caseworkers I worked with were afraid to bring cases because they're like, I've already got a full plate and I don't need to bring a case to the team, only to hear that there's going to be 8 recommendations of things that I do. And so if you can share those responsibilities or those tasks with other members of the team, that can be really helpful. And of course, it's going to make the caseworker want to bring more cases to the table and tell her or his coworkers that these are possibilities for them, and that they would actually benefit from coming to the E-MDT. So that's a piece that, you know, it's always hard. I think we were just talking about it before we actually started the webinar, is that people are overworked and people are feeling the stress right now. And to do, bring a case to the team might be a little too much. So if there's ways that we can really promote this as being an option and something to make their workload a little bit easier, then that's what we want to do. So the last one I want to talk about here in case finding is the team membership. You know, again, as the E-MDT coordinator, we have these really unique skill sets, and one of them is victim outcome. We are very focused on the outcome for that individual that we are, the case that we're reviewing. But we also have to think about how we are developing a team and getting them to work together with trust, with respect, in an efficient way. So we have to think about team development and how that comes out in our work. So developing some ground rules. I never had official ground rules. I know there are some teams that do. It just never came to that place. But I think that that's always an option. You know, you might need to determine how you're going to set up a case review process and when you can take questions, when people can provide feedback, depending on the uniqueness of the group. I think everybody knows about the one person that has a comment for every single thing that's being brought up. And sometimes you have to figure out ways to kind of work around them. So again, developing some of those skills, some of those strategies, depending on your team. Conflict resolution for a person who really hates conflict, that was a challenge for me. But there were some teams where we had folks that their presence was not really benefiting the team or the victim, and their input was actually starting to cause some rifts, and our whole team dynamic was impacted. So developing some strategies on how to deal with that is an important one. And I think, team membership, this is one of those areas where we could really do a full hour webinar. I would really encourage you that if you are struggling with some of those issues, to reach out to TA, because we can really walk you through some of these processes and ideas, and give some feedback. So that's another option. And then, the final piece about our team is you want to get the feedback. You really want to know what your team members think and how they feel the process is going. Is this helpful for them as team members? Do they feel like they're being utilized to the best of their ability? Do they have ideas about how the team could run more efficiently or effectively? Do they have ideas about how they could get more cases to the table? You really want to get that feedback. And further into our webinar today, I will be talking about some feedback surveys and giving you some samples of those as well that you can use. So to summarize our case finding, make sure you are reviewing your purpose and your eligibility criteria for your team. That is something that's ongoing. I can honestly say that my very first team, I pretty much took any case that came across the table. It's like, if it had elder abuse, we are taking it and we are reviewing it. As your team evolves and you start getting more cases, or you find that that's not really effective, you might start throwing in some different ideas for eligibility. But again, know it and work with your team on developing your criteria and your eligibility. Benefit or highlight the benefits of collaboration. Everybody wants to have a reason to come to this team. And if it's run well and you are really making some strides for victim outcome, or these cases that are being reviewed, that is going to actually speak for itself. So benefit the caseworker or the presenter, and benefits for the victim, and really stress that this is a great intervention for that. One of the things that I did when I first started out, we had no cases. And so I started taking cases from other counties that I had worked in and changing up the information. And we actually worked a mock case. And it was a really great experience. It gave the team members an opportunity to work together and kind of learn about each other and how they work and how they function. And we really kind of got a sense of where everybody was coming from. But it also sparked some ideas for folks. They're like, oh, so these are what you're talking about. These are the cases. Before they were saying, we don't have any cases of elder abuse. Once they heard these mock cases, they were like, that's what it is. And I have something, and I know something that's going on right now for me, that this would be a perfect case. So it kind of gets the ball rolling. And it's kind of a low pressure way to do it as well, because you're not really going to be implementing these things, but it's a way to just sort of get things moving along. Again, our teams evolve, with every month there are changes and there's ins and outs that we have to consider. But I think one of the important pieces to always be thinking about with every case is who's missing. Who do we need at this table? And it might be case specific, or it might be as a team. Who would bring the most helpful insight, or who can bring some different perspective on these cases, and how do we get them to the table? Those are always important questions to be asking. And really importantly, it's working well. I think we're great at identifying all of our deficits, but sometimes it's important to point out what we're doing really well. And our teams need to hear that, because we focus on, well, we're missing this person and this isn't working and this isn't working. Well, sometimes teams want to hear, I appreciate you being here, and I see this as being a really great thing. And this is what is happening in our community, and it's a positive. So kind of balancing that need with, this is really good stuff to always consider. So before we jump into case criterion, I don't know if we've had any questions in the chat, or if anybody wants to take a break and ask a question.
Not seeing any in the chat so far, but anyone can unmute if they do have something.
All right, then let's just jump right into case criterion then. So when we talk about case criterion, it's like the E-MDT. It is it evolves, it changes as your team's needs change and as your community's needs change. But some of the things some just general things to consider when you're determining your eligibility, one is work with your team. So you need to know what your team members think and what type of cases they want to be bringing to the table. But other ideas, geographic parameters. One of my counties was a really long county. So we had the northern part and the southern part. The southern part had all of the basic services. It had our homeless shelter, it had our DV agency. So the northern part of the county, they oftentimes access services in another county just over the border. So when we started talking about who could be at the table, we actually had to consider some of those out of county folks because they actually had some really important parts to play in some of the case reviews. Age requirements is another one. Our first MDT, I was the victim advocate, and I was a victim advocate under the Abuse in Later Life Grant, which serves individuals that are 50 years and older. So I brought a number of cases to the team for like 55-year-olds, 56-year-olds. When we switched our grant and switched our funding, we had to change that, and our age requirements changed to 60 and older. So you have to look at your grant requirements and the parameters that you're working within. Are you going to take substantiated cases only? So that would mean, are these cases coming from APS, prosecutor's office, however other ways substantiated cases could come? Or are you willing to take suspected cases? And that might be able to include a more diverse group in your community, some of the housing, residential programs and things like that might have some of these issues, and they suspect cases of abuse. This could be a resource for them. But again, working together as a team is going to be key, because if you have part of the team saying, well, we don't want the suspected cases, we're only going to take these to prosecution, then that needs to be considered as part of your eligibility requirements. And then accepting referrals. Who's going to refer the cases? Is this coming from APS? Is it coming from the prosecutor's office, community agencies? And how do they make these referrals? Is there a link on a website? Is there going to be a brochure with your contact information and they can call you and then you send out a referral form? Those are pieces, again, that you work out within your community and what's going to work best for you, your agency, and your team. But again, it's really important that those referral either documents or referral messages get sent out. I always sent one out to my team and we had a coalition for our county with the referral document, and then a friendly reminder saying, hey, if anybody has a case they want to bring, feel free to contact me or fill out the document and send it back to me as a friendly reminder. I'm sure that my friendly reminder started turning out to be like the nag email from me, but they got to know me after a while. I was just persistent. So this is a really quick and easy flow chart about referrals. So you've done all that hard work already, determined how your referral documents are going to be accessed and so forth. And that referral comes into the E-MDT coordinator. And the E-MDT coordinator does a nice screening, if you will. And maybe that's your language, maybe that's not your language, but the E-MDT coordinator has an intake document perhaps, and I will have samples of those further in, where I used it as an internal document, and it was sort of my template that I used to take the information that, again, my team helped me devise, and they told me what they needed, what information they needed. And we kind of have a conversation about what's going on. Maybe this case is ready to go right to the E-MDT for review, but maybe it needs to be a case consult. And in that case consult, you're giving some strategies or some intervention ideas to the referral person. Or maybe you're giving them ideas of what they need to get to bring it to that level that would warrant an E-MDT review. Again, that case consult piece, I think, is so important. It's yet another skill that the coordinator needs to have. We have to have those really good communication skills. Ooh, that moved on its own. Have those really good communication skills to communicate and pull that information out from the referral source. And again, once you've gotten it to the level of going to the case review, that's when the coordinator works with the referral source in developing the case presentation, making sure you've got all those players that are part of that case at the table to do the best possible case review and make the best intervention plan that you can. Some factors to consider for taking a case. As I said earlier in the beginning, I took any case that I could get and I was happy for it. But as things evolve and you start having more cases and you need to start kind of triaging, these are some of the things to consider. Is that individual in imminent danger? Are there co-occurring types of abuse? Are there multiple systems that need to be at the table? And I think that's a huge, huge reason for our E-MDT. Having APS, having law enforcement, the prosecutor's office all together to work out some of these issues, that's why we're here. You want to think about capacity issues. So if you've got a geriatric psychiatrist on your team or some form of a mental health provider that can do those types of assessments, those will be really important cases that you want to bring. I have another document that will be sent out afterwards that has a list of different factors to consider when you're making your criteria and you doing your referral process. But these are a couple of the really kind of important ones. So when we talk about our case presentation, as I said before, you got to have a good meeting to have people want to come back. And I know it's not just so that they'll come back, but it is because we want them to come back and we want them to bring more cases. And we want that victim outcome. That's our key. So that coordinator and the referral source really need to be working together to really get everybody at the table that needs to be there. We need to make sure that all of the information that our team is requesting or that they normally like to have, like if you need financial documents or whatever the case may be. Sometimes there are some folks that go and can get their property deeds and things like that. So you do your legwork with your referral source. And I also want to point out too that there are times that the E-MDT coordinator can be the one to do the reach out and asking these folks to come to the meeting. But you might want to consider too that your referral source is that person that those folks know. And sometimes they get a little better response. So again, working with your referral source and determining what's the best plan. There's no one like concrete way to do this. But again, communicating with them is really important. So when you're doing your presentation, there are a couple of things to think about. One is a PowerPoint, and I do have a sample of some PowerPoints that have just some of the basic information about the case. Some of you might be using Zoom or doing a hybrid model, so you can put that up on the screen. Some of you might have the technology in your in-person room, so it really depends on your particular team. But the agenda, it's more than a consideration. I think that's a must-have. You really need a thoughtful agenda that you've put time in and you know the case. So you kind of have a sense of your timing as well. And you really want to be mindful of the time. My first team, we spent an hour on a meeting. So I was really very careful with my timing. And sometimes I had to switch things up. So my follow-ups went to the beginning because I knew the follow-up might be a little bit more intensive than the actual case presentation. So again, every meeting, you think it through, you think about the people that are in the room, you think about the case that you're presenting, the follow-up information, and you create the agenda that's going to be most effective for your team. I thought I turned my little notification off, but it popped up, didn't it? Can you see that? Okay, good. Anyway, pardon me. So yeah, so meeting agenda, very important. And then confidentiality agreement. It is our job as coordinators to make sure that no information sharing, client information, any of identifying information is shared before that confidentiality agreement is signed. And I would also say here, this is a great place for TA. We have a lot of resources on developing confidentiality agreements with your teams and how to go about that. So please be sure to reach out to one of us if you're struggling with that, because we do have a lot. Consider how you're sharing identifying information. Depending on your confidentiality agreement, you may be allowed to actually use case names or individuals' names. You may need to use initials or pseudonyms, fake names. Either way, you want to have that determined before you actually have your meeting. And again, have that all set up and prepared prior to the actual E-MDT meeting. So questions. Depending on your style as a facilitator and depending on your team's desire, some folks like to have a good 10-minute block where they're just doing a case presentation and then the discussion happens after that. Some people like a more conversational style. That was my style. I tended to like to have the case presenter start talking and then people kind of interject. I think it's harder for a coordinator because you kind of become a border collie. You really have to work at keeping everybody's, on task. So you're kind of nipping at heels and doing those things. And, it takes a little extra work, but again, it depends on your style and what you're most comfortable with. And then time, as I said before, it is so important that time is you keep track of it and that you keep to it. Many of our professionals that are at these team meetings are donating their time, if you will, and we want to respect that. So going a half hour over may not be an option. So you want to keep things as together as you possibly can. Okay. So a couple of tips to consider. Avoid verbatim accounts. That's my favorite because you're sitting in there and there's talking about, well, so Susan went to the doctor and she said this, and then he said this to her. And all of a sudden you're kind of lost, like, wait, who is telling who what and how did this happen? And you kind of have to backtrack. So it may sound a little awkward, but as you prepare your case presenter for actually using the names, that would be really helpful. So Susan went to the doctor. Dr. Jones told Susan this, and it's awkward, but it really is a little bit more clear and it keeps things a little bit more streamlined, if you will. Eliminate the acronyms. So we all know APS, TBI, things like that, but there might be folks at the team that do not. So you want to take that into account and be respectful. And they probably, even if they don't, there are always going to be somebody like, wait a minute, I don't know what that is, but there may be some that won't, and they don't want to interrupt the meeting. So please take that into account so people have a sense of what you're talking about and all of those fancy little groups that we talk about in our world. I know I said it before, you really want to make sure that your expertise is being leveraged. I mean, you've got some really great team members, whether it be your prosecutor or some of the law enforcement, some of your victim advocates, and really have them be a part of that conversation. And sometimes they might need a little pulling and kind of bringing them along, but they bring really important pieces to the case review, and you want them to be a part of that. So the provide relevant details, the example that I have of this, I still laugh thinking about it, so I'm going to keep myself together. I was doing a case review and it was a pretty intense case of abuse, of financial exploitation. And it was a rural area where everybody kind of knew each other. And the case presenter went on to talk about the alleged abuser, the suspected perpetrator. And she said, yeah, and he brings all these floozies back to the house. And my mouth dropped. I'm like, oh, okay. We're not talking about floozies right now. And I still can't believe she even said it, like in a meeting. So the border collie and me came out and I nipped and, got everybody back on task. But again, we want to provide relevant details, and that was not a relevant detail, and took me a minute to write myself, but we got there. So yeah, remember the floozies. Is that appropriate to say? I see Lisa's laughing, so that must be okay if I said it. Okay, good. And then again, making sure your team is part of the discussion, leaving time for communication with them, with thoughts, ideas, opinions that they may have, and letting them know, or making sure that they know that they're part of that team and their insight is important. So just in summary, make sure that confidentiality agreement is signed, sealed, and delivered. It's an important part of the work we do, and it has to be there. We are responsible for that. It's on us. Making sure you've got a good, solid agenda that has been thought out, and a lot of energy and effort has been put into making it an effective team meeting. and making sure that case outline reflects that as well, and that your referral source is ready to go and present that information. So again, I'm going to take a little break here. If anybody has questions, anything in the chat?
Nope.
Okay. And it's one of those things too, where as coordinators, we are not used to doing all the talking, because really our goal is to get everybody else to talk. So for me to talk at you now for an hour feels a little strange, but I'm finding a way to fill the time, clearly. So, all right, let's jump into the tracking system. So as coordinators, you got to have great communication skills. You have to have great facilitation skills. You really need to be able to present and put, trainings on and do all these important tasks. And in addition to all of those things, you got to be really organized, and you got to be good at tracking and keeping tabs on everything that you're doing. Because we know, like in social work, they always say, when do you start discharge planning? When you do the intake. Well, it's very similar to grants and to programs that we are in. When do you start talking about sustainability? As soon as you start the grant. So one of the ways that you can start thinking about sustainability and putting some stuff into motion is by considering your tracking and your recording systems. So we'll talk a little bit about different forms like the referral and intake, the suspected abuse risk evaluation, which I think is a really important one. Feedback surveys, we're talking about restitution and tracking our specialists, and follow-up, because follow-up is a really crucial part of the work that we do as coordinators, of keeping our teams on track, but also making sure that the victim outcome is favorable. So the first form I want to talk about is the referral. And I think of the referral form as sort of an external document. This is, again, where you've got to decide how you want people to access the referral document. Or, if you're fortunate enough to have an agency that can perhaps have a portal that they can click on, I mean, that would be fantastic. Or maybe it's just a link on a website. However, your team can actually get that referral document out. Maybe it's a flyer that has your contact information or has the document on there, and they can do it by hand and scan it and send it. However your team can do it, however your community can handle that, it would be great for that. And your referral documents just got your basic information. This is just sort of letting putting the presenting problem out there, maybe some basic demographic information. And again, it should reflect what your team needs to take a referral. So again, this should be reviewed with them as you create it. I will have tons of referral samples as well from other teams that come from different agencies. So some of them are victim service agencies, some of them are like the prosecutor's office. So there's different types of referrals. The intake reference document, I think of that as the internal. That for me was my template. That's what I used when I was on the phone with the referral source and I needed more information, and I really needed to make that determination as to whether this case was ready to go to the team to review or if this was going to stay in the case consult stage. I got the little second bullet point there, structured and organized to reflect your database or spreadsheet workflow. That's just a learn from my mistake, because I created these documents and I used some of the New York State templates and things like that. And so then when I would be doing the work, nothing flowed. So I'd be doing my intake information and then I needed to transfer it into the Excel spreadsheet. But the information that I had first on my document was like the last thing on the spreadsheet. So I'm scrolling down here and it was not very efficient. So I learned and I kind of revised things. So if you can do that from the beginning, it could be helpful. And if you're fortunate enough to have a database already, one, I'm truly jealous, but two, base it on your database flow and how that's working too. And again, your intake is your guide. It's going to prompt you to ask questions of your referral source. It's going to get that information, pull out those pieces of information that you need to make that decision if this is going to be a case to move forward. So the risk evaluation. I think this is huge. As an E-MDT, we are there, right, to prevent abuse or to prosecute or to have an impact on elder abuse. So it's also our job to make sure that our victims are safe and doing a risk assessment so that we are being cognizant of polyvictimization or co-occurring forms of abuse is really important. And how often have we gotten cases either as service providers or as an E-MDT where it came in as a straight financial exploitation, but as you're talking, you're like, whoa, there is a lot going on here that did not come out in the referral. There's physical abuse going on, there's sexual abuse going on, or whatever. This is an opportunity for your team to weigh in about their concerns about the actual victim. I would pass this out at every meeting. And at the end of the case presentation, each team member put in their ballot, if you will, about what they felt the risk was for each of those types of abuse. And then I would do like an aggregate form at the end and send that out to the team members so that when we met again, we had a better sense of what we were looking at. It really helped to inform our recommendations and our intervention plan. Because again, if it came as a financial exploitation only, and we never addressed any of the issues of physical abuse, then we're only doing part of the job, and we are there for the victim and their outcome. So I think it's a really important piece of data that we need. And then I also used it when we closed cases, just to see that those risks were lessened. So we always aimed for low to no risk. I think that we know in our work that that's not always feasible, but we do our best to get there. Feedback. I've said it now a number of times. Feedback is so important. It's important that we know how our team is moving forward, what they're thinking, how efficient we are, how is our victim outcome, are our victims being served to the best of our ability? So this is one sample that we used, and I initially used it at every meeting. So we would pass it out after every meeting, and it just gave some general information about the productivity of the team and how operations were going. And as I said earlier, we had an hour. So by the time we did follow-ups, case review, and we did our risk assessment, the surveys, it was getting to be a little much. So we actually shifted and we started doing surveys every 6 months. And I will have a sample of that survey as well. And it's based on, it was like the Navarro survey. There was an article attached to it and then the actual assessment. So that will all be in that package that we're sending out. But I would give that survey at 6 months. And then the following meeting was our sort of take stock meeting where we gathered. We might do a couple of follow-ups. We didn't really do a full case review at that meeting and really talked about where our team was, what was working, what wasn't working, who are we missing. It was an opportunity for the team to really kind of get down to the nuts and bolts, almost like a strategic planning meeting based on the survey results. So again, so important. We want to make sure our teams are being used to the best of their ability, but we want to make sure that our team members are feeling like they're helpful, they're part of the team, that they respect and trust one another. So keeping track of that is really key. So this next part is tracking our specialists, and every team probably has a different group of specialists that they work with. But when I talk about specialists, I'm talking about like the geriatric psychiatrist or the mental health professional that might be serving to do capacity assessments, things like that. Forensic accountant, civil attorney. Some of you in your grants might have consultant dollars for these folks, or some of you actually might have them as part of your team already. But you really want to be tracking how you use these specialist services and the impact that they're having. Again, I want to believe that the reason we do this work, and it is why I do this work, is to help victims of abuse. But to do that, we need dollars, and then we need data. So this is a way to provide really good data about the work that you're doing as a team. It helps your grantors and knowing that the work is being done. It helps your agencies that are participating because they're seeing this stuff and realizing that this is a really great service and intervention. So keeping track of it, while it might be tedious, is just a really, really important tool so that we can continue to grow this process and do this work. So the geriatric psychiatrist or any mental health professional, I know that there's a tremendous shortage of psychiatrists in the area or in the country. So a lot of folks can't access one. So any mental health professional that you might have serving your team, you can keep track of these issues. But you really want to look at, how is the geriatric psychiatrist being used? Is it for case investigation? Are you using it for guardianships? And what is the outcome? You know, how does that guardianship impact that older adult that you might be serving? I think some areas use guardianship as just like the first thing that they go to, and it's not necessarily what the victim wants or even needs. And then there are some areas that the guardianship, it doesn't get pulled out and they probably need it desperately. So again, having a narrative or having some form to document the purpose of your geriatric specialist would be really helpful as you move forward. And also, I didn't include in here, but sometimes you're required to document your dollars and cents piece too. So we had consultant dollars, and that I would include in my my documentation for our geriatric psychiatrist and civil attorney. Our forensic accountant was covered under a different system. So it may need to include that as well. So the forensic accountant, very similar, things to be documenting. We actually used our forensic accountant a lot for our victims who didn't believe that they were being exploited. So they said, well, I said my son could have $100 and it's fine. I'm sure he didn't take much more within that. And so then the forensic accountant came in and kind of did some of the work with her financial documents and found out that she actually had given him $200,000. So when she saw those actual numbers, it was really powerful, and she was actually willing to move forward with the case because she realized that he had stolen from her. So again, why are you using these services? What's the outcome? So did the use of the forensic accountant lead to a law enforcement referral and eventually a prosecution, restitution, perhaps? So documenting all those things are really important. Same thing for civil attorney. We have a lot of different reasons why we have civil attorneys on our teams. We had a county attorney that handled all the county guardianships. And then we had a private practice attorney who really just gave us some guidance on the legal system, the civil legal system, and how things can work or not work, and then took referrals because they were with the Legal Aid Society. So really depending on how you're using your civil attorney and what purpose they have should be documented as well. And of course, the outcome of the case. We want to know those things. Although sometimes the outcome takes a long time. I mean, I had some cases that went 4 years, and I remember that little space on the side there that just seemed to never fill in. Eventually it did, but it took 4 years. Restitution, that's another important piece. I hate that our work is sometimes, narrowed down to dollars and cents, but it is a piece of the work that we're doing. So if we can document that our work as an E-MDT is getting restitution orders, and some of our victims are actually getting money back that has been stolen from them, that is really, really significant. And we want to have that documentation so that that can be presented again to our agencies, to our government agencies, to our grantors, to know that this is a really significant and important intervention that we're using and that we're promoting. Case follow-up, all of the work that we do throughout the month or quarter or however you measure it, if we're not following up, then it just falls away and it's almost for naught. So documenting what we do and following up on those things is going to be so, so important. I think that it's a piece that, there's so much work that goes into prior to the meeting and then the meeting, and you're exhausted at the end and you're like, I really should email them. I should call them. And it's hard, to get that, or they think I'm bugging them. But the only way we can move forward is if we have that sort of border collie going after people and kind of nipping at heels to make sure that these things are happening, these recommendations are being followed through on, and that the case is moving forward. And depending again on your circumstance, you might have a database where you can do all of this, or maybe you're creating your own. There will be samples of that as well. But again, finding a way that you can keep track of the cases, who's involved, is really an important piece to being a coordinator. And then there's my little loop here, which I love. Always take time to close up the loop, because you just don't know if that person, and again, that may be with the best of intention that they said that they would take on a task, and it's life happens, right? And they forgot about it. And your little nudge might be what makes them do it. So again, think about it as you're putting in all that work for preparing for this meeting, you're getting things going, and then that loop right there in the middle is doing the work. And that's where all of the back and forth, the trust, the recommendations, all of that is happening. And then you close out. And if you don't follow up on it, all of that stuff in the loop is lost. And you don't want to do that. That's not going to be what's best for the victim. And on the kind of opposite side of that is you do all of that work and you get into that little loop, and it goes south fast. And you've got maybe some contentious stuff happening, or people shutting down and not paying attention, or whatever's going on. At the end of that meeting, if you can pull some things out, it may be even just saying, we're going to revisit this next month, or it could be, we need to look in for more information on this. However, whatever it could be that you can pull out, then that meeting was not done in vain, so to speak. There's a purpose. There's still going to be recommendation and tasks that you're going to be putting into place so that that victim can get some type of service, whatever that might be. So again, really keeping track of those follow-ups and following through on those meetings. It's hard work, but it is so, so important. And then finally, just some indicators of what a healthy MDT might be able to look like. And it doesn't necessarily mean that if you don't have any of these, that your team is not healthy, or if you have all of them, that you're super healthy. But just some ideas to think about as you're moving forward and building your teams is, have you identified a meeting coordinator or facilitator yet? For some of you, that's the beginning stage. You haven't even identified anyone. So if you've got a coordinator now, there you go, one step closer. Maybe you've created some good onboarding or orientation material that has been bringing team members to the table and getting them to be active participants. Maybe it's as simple as you have developed some form of protocol that your community uses now for elder abuse, or you're actually making it so that people are aware that elder abuse is an issue in your community, because there are a lot of communities out there that say it doesn't happen there. They just aren't seeing the cases. So that could be a piece. You might have worked on some great conflict resolution strategies and ways to deal with that, receiving more support from your agencies. I can tell you that my agency did not know what I did. They couldn't even say my title. E-MDT coordinator was just like, wait, what do you do again? So when I was actually able to come back with some of the successes that our team had, it made it a little bit more real to them. And they really started to appreciate that work. Having earned the trust, the respect, and the commitment from your team members, we know that there are some disciplines that are really hard to get on board for these meetings and these teams. So if you've been able to do that, that's a huge, huge win, and it's only there to benefit the victims that you're serving. So that's significant. And again, it's going to happen. If it hasn't happened already for you, you're going to make some mistakes. I had my foot in my mouth quite a few times, but being able to acknowledge those mistakes and your weaknesses, I can tell you that follow through, it's probably why I've pushed it so hard, was one of my least favorite and least, I was just not very good at follow through. I needed a lot of nudges myself. So again, I acknowledge those things, that weakness, and we're human. We make those mistakes. And then the last one, to celebrate. I think that's such an important thing. I never did this, but Allison Granata in New York State talked about one of her first teams that had a case that went to prosecution, and then they got a restitution order. And so at the following meeting, she brought a bottle of sparkling cider and champagne flutes, and they did a little toast and had a little celebration over the outcome of the case. And I thought that was really cool. So that maybe some of you could try that, or at least acknowledging the really hard work that's being done with your teams. So just a few options there for a healthy team. And now, oh my gosh, it's 1:58. So there's not a lot of time for questions, but whew. Any questions?
I'm not seeing any in the chat, but if anyone does have questions, feel free to unmute. We do have 2 minutes left.
And we are going to see you all for the next 3 years. So we'll be able to find you with questions now.
Betsy, is it okay if we can get a copy of this PowerPoint?
Yes, so Anna's going to be sending out the PowerPoint along with the documents and all of the different materials that I referenced.
Perfect.
So everybody will get those as well.
Thank you.
Awesome. Thank you so much. Again, fill out that evaluation and we will see you next time.